Good morning. My name is Deontay. I am a family nurse practitioner, and today I'm going to be educating you all about behavior management. Specifically, I want to talk to you about ways that we can prevent aggressive behavior in patients, and in the event that their behavior escalates into something more aggressive or threatening, different techniques we can use to de-escalate that behavior and make sure that not only the patient stays safe, but we're safe as well. Let's begin. So, just some course objectives to outline what we're going to be talking about today. First, I want to make sure that when you leave this course, you are able to identify common causes of aggressive behavior. We're taking care of patients in a very special population, and in order to be able to successfully treat them and provide the care they need, and specifically deal with the aggressive behavior that some may have, we need to understand and be able to identify why they may be having this type of behavior. So that's something when you leave this course, very important. I want you to be able to identify some common causes of aggressive behavior. Next, you will be able to list several early warning signs that a client may be becoming aggressive. So the elderly patients that we're going to be caring for, and just any patient in general, there are warning signs that you can look for and identify that will let you know that, hey, this client may become aggressive. I'm going to keep a close eye on him today or her today. And I'm going to let my staff know as well what I've noticed about this patient today that may be different from yesterday or the day before. Some warning signs that we should keep a lookout for. And this will come to you more easily as you have worked in the field with the patient population, and of course, after you've worked with a specific patient group at a specific center longer. But without that experience, learning to identify these early warning signs is very important. Next, you all will be able to understand and discuss methods to prevent a patient from becoming aggressive. So sometimes, unfortunately, we can understand the patients we're taking care of. We know reasons why they may become aggressive. We even have a firm grasp on the early warning signs, and we've identified them properly in a specific patient. Just because we're able to successfully do those things, we need to know how to additionally prevent that patient from becoming aggressive. After we've identified the early warning signs that this patient may become aggressive, what are we going to do to prevent them from becoming aggressive towards us, towards another staff member, or even towards another patient at the facility? So this is very important because not only are your coworkers counting on you, the patient is, and the patient's family, and the other patients in the facility as well. Last, but certainly not least, I want you to be able to understand what to do if the patient becomes aggressive towards you. This, unfortunately, is a situation that I have found myself in my practice, and I've also seen other nurses found themselves in. So whether you're a nurse, whether you are a care partner, or just a caregiver in a facility, it is important that you know specific techniques that will de-escalate this type of behavior and how to keep yourself safe. Very important. So those are our objectives for today. And at the end of this course, I want you to think about these objectives and be able to fill those boxes with the check mark. Say, check, yes, I understand these. I have a firm grasp and I'm ready to apply what I've learned in this course to my job. All right. So first, what causes aggressive behavior? And you see I included a picture here, all these beautiful faces of these people, these elderly people here, and they all are happy. But this, unfortunately, isn't always the case. So what can cause these beautiful, sweet people to become aggressive? Well, for one, I know for myself personally, if I haven't had enough sleep, I'm also a little grouchy. So a lack of sleep, they're in a new environment, they're not in their own bed that they've been used to for so long, or maybe they've been in this facility for a while and they are used to the bed, but just for whatever reason, they're not getting enough lack of sleep. That could be due to the medications that they're taking. Maybe they had a new medication. Maybe they had a medical test or a result come back that wasn't what they were hoping for. And it's put them under some type of psychological stress, and they're just not able to get enough sleep. Or maybe it's just the medication itself. Maybe a side effect of the medication is nausea or dizziness, and when they lay down, they just can't get comfortable. So those are two big things that are definitely causes of aggressive behavior. Um, Psychological stress as well. Um, Maybe they're having trouble accepting um, their age and their physical symptoms of age or whatever disease they may have. Or maybe they're just having trouble coping with the fact that they're aging, and they want to be at home with their family, or they want to be able to be more active and they're not. So this could definitely cause some psychological stress that may lead to them lashing out towards staff or patients. Inability to complete ADLs. This ties in as well with the psychological stress. This population, they often, some are wheelchair bound. Some find themselves very weak in the legs and they can't walk, or they need assistance to stand, or they need assistance to get to the bathroom or help taking a shower. These are all things that they may already be dealing with, but for whatever reason, on a certain day with a certain person, maybe they're just not having a good day. Maybe they're just not happy about their situation. So an inability to complete ADLs. ADLs is assisted daily living activities such as showering, eating, using the bathroom, walking, just taking care of yourself. Things that me and you can do with no problem, but unfortunately this population, they can't. So it brings them some stress, and unfortunately sometimes that stress can develop and present itself in an aggressive manner. The three big things that I want to focus on, I put them last here, is their diagnosis. So dementia, Alzheimer's, and stroke particularly are three diagnoses that, pardon me, that patients, elderly patients in particular, have, that symptoms of these diseases uh, is aggressive behavior. And sometimes the medication that they take um, also accelerates that aggressive behavior, or not accelerates, but makes that aggressive behavior come out. So these are some root causes of aggressive behavior. What causes aggressive behavior? Disease prevalence and incidence. So from the last slide, I pointed out diseases, the diagnosis of dementia, Alzheimer's disease, and stroke. So why in particularly did I pick out these three diseases? Well, because given the population that we're taking care of, dementia affects 1 in every 10 people aged 65 and older. So it is very likely, 10% chance, if not more, that one of the patients in the facility you're taking care of has dementia, may have some signs and symptoms of dementia that is onsetting, or maybe they are likely to start developing it in a few years, or maybe they have a familial history of it. So we really want to understand what dementia is, because this is a root cause of aggressive behavior in the elderly patients. Also, Alzheimer's disease. Alzheimer's disease is the single most common cause of dementia. So Alzheimer's disease causes dementia in older adults. An estimated 5.8 million Americans aged 65 and older have dementia in the current year, 2020. So again, dementia and Alzheimer's disease, these are two very prevalent diseases in the elderly population that put them at risk to have this aggressive behavior. And last but not least, I included stroke. Stroke is the #1 cause of long-term disability in America among the elderly. So many of the patients you care for either have had a stroke of mild severity or very high severity that has caused some type of disability, whether it's a physical one that you can easily see or it's one that's more mental or vocal. Sometimes stroke affects each individual very differently. So dementia, Alzheimer's disease, and stroke are three huge factors in the elderly population that we can identify as root causes of aggressive behavior. But some of you may not know exactly what dementia is, or you have an idea of it, but you're not 100% sure. So we're going to clarify here today. What is dementia? Well, dementia is not an actual disease. That's why I went back and forth between disease and diagnosis 2 slides ago. But it's rather a word that describes a group of symptoms that all affect a person's memory, the way that they think, can they process what you're saying and make an informed decision, an appropriate decision. It also affects their ability to socialize. They may seem a bit antisocial or strange because they may laugh inappropriately or display the wrong emotion. And these symptoms that they suffer are all a result of dementia. And dementia, just on a physiological level, dementia comes into play because it's uh, when the brain cells start to just degenerate. Just as a person gets older, certain people are at risk for it and certain people aren't. But basically, it's just their brain cells are, the wiring around them is being worn down as they age. And so as a result, these symptoms do come about. So these people, they don't have a good memory, they're not able to think as well, they can't make decisions. They're very forgetful. They may even forget who their family is. They may even forget who you are and you just introduced yourself to them 20 minutes ago. So of course you can see how this disease would play, I'm sorry, not disease, this diagnosis would play a role in affecting their daily life. And also how someone could become aggressive. If I have a very bad memory and you tell me who you are when you come into my room and help me to my bed, and then you come 5 minutes later because you forgot something or because you wanted to check on me and I forgot who you are, I may be startled by your presence. I may become upset that you're in my room and I don't know who you are. Um, so dementia, that's a very, as I said, high risk, places these elderly patients at high risk for aggressive behavior. Next, I just put this chart here because it really illustrates all the different behavior changes associated with dementia. And #1 they have listed here is aggression. Aggression can be physical or verbal. Verbal, of course, screaming, cursing; physical, hitting, biting, kicking, scratching. It could be non-aggressive behavioral, repetitive questioning, or complaining a lot. Those are early warning signs that if you know this patient has dementia and they're complaining a lot today for some reasons, those are the early warning signs that, hey, this may escalate today. I'm going to make sure I really keep an eye on this patient and use some of the techniques that Deontay taught me in the video to keep this patient from becoming aggressive. Physical, we have wandering, pacing, rummaging, hiding, taking other people's belongings. In my experience, I took care of a patient with dementia who took someone else's belongings. And I understood that dementia was a disease of the mind and it really affected people's memory. But I didn't think that taking other people's things could be interpreted as almost a non-aggressive symptom, not a non-aggressive act, but actually it is non-aggressive and it could definitely escalate into aggressive. So you just want to make sure, just read through these. I'm gonna leave this here for a minute and just talk for a second so you can read through all of these different behaviors just to know what to expect when you take care of someone with dementia. They might likely have anxiety, easily irritable, poor food intake, low appetite, sleep disturbances. Remember I said lack of sleep was a root cause. This is why, because it's very much tied into dementia. And those three diseases that we talked about, dementia, and next up, Alzheimer's disease. So, what is Alzheimer's disease? Alzheimer's disease is the most common cause of dementia. Remember, dementia is not a disease, dementia is a word used to describe a group of symptoms. Alzheimer's disease is the most common cause of dementia in older adults. It's a progressive degenerative brain disorder that impacts memory, behavioral, social, and thinking skills, just like dementia. And all of those symptoms grouped together play a very large role in how they affect a person's daily life. So, again, we can imagine how someone with Alzheimer's disease would have this aggressive behavior trait inside of them, and how it could so easily come out when they're having trouble with their day to day. For instance, let's say we have a patient who we are taking care of, and we ask them to take a shower. They're supposed to take a shower by this time so they can get into bed by a certain time. And we're asking them, one, two, we're encouraging them, we're collecting the towel and things for them to take a shower. Well, we we can't forget that the patient may not want to take a shower because it's so hard for them physically, because it's such they have trouble with their daily living activities. It's hard for them because they forget, or physically they're older, so they're weak. They don't like to stand up as long. So it's not that they're being disruptive or they don't want to cooperate. It's because they have these diseases. So we need to make sure that we understand these diseases, how they affect this specific population, and what we can expect from people we care for who have dementia, who have Alzheimer's disease. So here I created this little colorful chart here just to illustrate what contributes to aggressive behavior and different behavior changes more associated with Alzheimer's disease. So aggressive behavior, why is this patient being aggressive towards me? I'm a nice guy. I've been being nice to this patient all day. Let me figure out what's going on with them, because I know it's not me. It's something going on with them, and it's something that's out of their control. So if the patient is being aggressive, maybe they're in pain, and they can't find the words to tell you that they're in pain, that their stomach hurts. Or maybe they're just feeling down today because they are really feeling their loss of freedom. you know um, they are used to getting up and going outside for a walk by themselves, or getting up and just walking to eat breakfast by themselves, and here now all these people are trying to help them and walk with them, and they don't like it. They feel like they've lost their freedom, and they feel like you're responsible for taking their freedom. Maybe they're having some bowel troubles with constipation, or a complete inability to control their urine or bowel. And it's upsetting for them. And that's why they're aggressive. And they don't want to have to ask you for help, but they need your help. And this is making them aggressive. Or maybe they're just feeling lonely. Maybe they don't want to be around their caregiver, you, or they don't want to be around the other patients in the facility. Maybe they want to be around their family, and they're just feeling lonely because the type of company that they're used to or that they want isn't around, and they don't know how to use a phone to call them. So if the patient is being aggressive, we need to ask them, hey, are you in pain? Are you feeling lonely? Is there someone you would like me to call? Do you want to go for a walk? Do you want me to bring you back to your room so you can be alone? Maybe they just want some time alone, some quiet time, off of the bathroom, things like that. So when the patient is being aggressive, we have to preemptively assume that there's something else going on, and we have to step up and ask questions about what's going on? What can I do to help you? Uh, Recognizing that they have this aggressive behavior, and that it's an indicator that something more is going on. Last but not least, I want to talk to you about stroke. So we've talked about dementia, we've talked about Alzheimer's disease, and last, we're going to talk about stroke. Remember, stroke is the #1 cause of disability in elderly in the United States. So what is a stroke exactly? Many of you have probably heard, either know someone that had a stroke or know someone who had a stroke. So we all have some idea. We've heard the word. So quite simply, a stroke is a name for an event that occurs inside your body when the blood supply to a part of your brain is interrupted or reduced, even for a minute, because each part of our body, specifically our brain, needs blood because blood brings oxygen and sugar and other things that our body, and nutrients that our body needs. So when the brain cells don't get that oxygen and those nutrients because there's been some type of interruption, those brain cells start to die. And if the blood flow to those brain cells isn't restored quickly, um, and quickly being 15 to 30 minutes at the longest, then those brain cells will never be alive again. And we don't know what that brain cell that died controlled. Maybe that brain cell that died helped control speech, or maybe that brain cell that died helped control movement on the left side of the body. That's why sometimes when we take care of stroke patients, some of them have trouble talking, some of them have trouble with memory, some of them have trouble moving their arm or moving their leg. So so that's a stroke. It leads to permanent cell death in parts of the brain, which may cause physical, mental, and behavioral dysfunction. Sometimes those brain cells even control our rational decision making, our ability to control our emotion, and both of those things play a large role in our behavior. So behavior changes more associated with stroke. So what can be causing the aggression in a patient that suffered a stroke? Loss of sleep. Um, Very common in my nursing career. I've taken care of elderly patients who they lose sleep. They come into the hospital. You know, you've been up all night, all day. Let's say they had a stomach ache. They've been up all day. They finally get to go to sleep. Pardon me. They've finally been able to go to sleep. But when they get to the hospital, everyone's asking them questions and poking and prodding. So now it's nighttime and they still haven't slept. So 5 in the morning, 3 in the morning, finally they get to fall asleep. But it's time to wake up. It's breakfast time. The doctor's coming back in, making rounds. So this changes their natural circadian rhythm. And this loss of sleep actually affects elderly people pretty severely and leads to something called sundowning, which is basically, it's almost like a split personality for this specific patient population. At nighttime, their complete mood changes. The nicest patients will just become very aggressive, um, very forgetful. Um, it's very alarming. I'll tell you one story of a patient I took care of. It was an elderly patient, a lady. She came in just the way I described. You know, she was not feeling well throughout the day, came into the hospital, was up all night, lost sleep. And then when she wanted to sleep, it was the daytime. So a couple nights went by. Since she had been admitted, and I took care of her again. And the nurse who I received report from told me that this patient had been sundowning. Um, so I didn't think much of it because I guess it was a very mild case of sundown, and she woke up confused, a little upset, thought she was at home, and the nurse was able to talk her back to sleep and tell her, you know, you're in the hospital, it's okay, I'm here to take care of you. But that night when I took care of her, that wasn't the case at all. Um, she became very aggressive. She pulled out her IVs. She thought that I was in her house. And that I was trying to take her things, and just very certain, wide awake, talking to me as if I was in her home trying to take her things, and asking for her husband who was at their actual house. And so it can become pretty scary. So loss of sleep, it's a big deal. Make sure encourage sleep with your patients. Make sure you provide a restful atmosphere. But we'll talk more on that later, on prevention methods to prevent that type of scenario that I described to you from occurring. So, okay, behavior changes associated with stroke. We talked about loss of sleep, sundowning, mood alterations. They can be depressed, they can have anxiety, um, they can be eager, they can be just this very wide swing of emotions. Also, extreme fatigue. Not only fatigue from loss of sleep, but just fatigue from physical activity, maybe the medications they're taking, the treatment that they're undergoing at the hospital. Can be all very draining on these people. So, extreme fatigue can also be a cause of aggression, because if I'm extremely fatigued and I want to sleep, but I can't, I just want to sit and rest, and you want me to get up and eat and I'm not hungry, and you want me to walk, and you just keep trying to do things for me, and really I just want to be left alone. That can cause me to become aggressive towards you. So we want to keep that in mind. Extreme fatigue in these stroke patients, especially because they've suffered that loss of blood supply to the brain that may have affected their physical their mobility, their ability to move their leg. Things may be 10 times as hard for them, and we're only trying to exercise them and do what's best, but we need to be aware that extreme fatigue can cause this type of aggression. Also, inappropriate behavior, laughing when another patient falls, crying at someone who tells a funny joke. Uh, like I said, that loss of blood supply in a specific part of the brain, we don't know where uh, that specific brain cell, we don't know what that specific brain cell controlled. It may have controlled emotions. It may have controlled emotions. So uh, you don't know how the stroke affected them, but these are some of the causes of aggression and some of the symptoms of stroke, post-stroke, that we need to look out for. Okay, so objective number 2, we'd already talked about causes of aggression. We talked about specifically 3 diseases: dementia, Alzheimer's disease, and we talked about stroke. So now I want to tell you guys about early warning signs of aggressive behavior. What should we be looking out for? And you see, I included this picture of this gentleman. He just looks very frustrated. Um, so paranoia, hallucinations, if the patient is just suddenly disorientated or wakes up from a nap very disoriented, you want to make sure that you treat that situation very carefully, because it can go one of 2 ways if the patient is very disoriented. Like the situation I told you about that I went through my own, the patient was disoriented. They could become aggressive towards you because they think that you're in their home and they're not in an assisted living facility anymore. They're in their home and you're an intruder in their home. Or maybe they think another patient is. Refusal to participate in ADLs. This is an early warning sign. I told you guys that extreme fatigue, or maybe just they want to be left alone, or they feel like have a loss of their freedom. They're always doing things with the group or doing things that someone else asks them or tells them to do. So refusal to participate in ADLs, that should be another key early warning sign that, hey, I need to tread lightly here. This could turn into an aggressive situation. Social withdrawal. Patient may be feeling loneliness, fluctuating mood. So those are all behavioral and cognitive early warning signs. If you see the paranoia, fluctuations, disorientation, those are all cognitive. Refusal to participate in ADL, social withdrawal, fluctuating mood, more emotional. And here we have the physical, swinging their arm at an empty space, not necessarily throwing a punch, just, kind of forcefully swinging their arm at an empty space when they're sitting down, maybe just talking to themselves or just relaxing. You just see them kind of swing their arm, you know. That's something you just keep an eye on and see what goes on. Yelling, pacing back and forth, if they're just yelling about things and complaining. So those are some early warning signs that aggressive behavior may be impending. So we're going to talk about the social indicators. I call them cognitive social indicators. Paranoia, disorientation, and hallucinations. They can be very subtle, and they can last 20 seconds, 10 seconds, or a minute. And they're usually pretty short-lived. That's usually, in my experience, how it goes. Very slight changes in the cognitive state can be an early warning sign. So let's say you wake a patient up from a nap, or you just happen to walk in and accidentally wake the patient up from a nap, and they're just confused about not just what time it is, but they're confused about what month it is. They're confused about the year. They're confused about who you are, and you've been there for your whole shift, and your shift is nearly coming to an end. And they're suddenly confused about who you are, where they are. This is a sign that aggressive behavior may be impending. Uh, as well as paranoia. If they're paranoid about something happening, it could be some big event like an earthquake, or it could be paranoid about someone messing with their food or taking their belongings out of their room, when you know for a fact that no one has been in their room, no one touches their belongings. Um, it could be just that disillusion in their mind. So make sure you really talk to your patients, you get a feel and know your patient, and you're able to recognize, hey, I know it only lasted a minute, but let's say Mr. Johnson was a little paranoid today. So I'm going to make sure I tell that to the caregiver relieving me so they can keep an eye on that, because I remember Deontay told me that that was a social indicator of early aggressive behavior. And next, we're going to move to cognitive indicators. Like I said, I got those mixed up. My apologies. So early warning signs of aggressive behavior, cognitive indicators. It's going to be refusal to participate in daily living, like taking a bath, uh, brushing the teeth, eating, social withdrawal. Um, they don't want to be bothered by anyone. Mood swinging. This is going to be a patient who's sitting by themselves, clearly far away from everyone else, not just sitting back watching, relaxing to themselves, but clearly trying to separate themselves from the group and everyone else. These type of actions should let you know that the patient is they're not feeling their best that day, that something's bothering them. They're upset about a loss of freedom, or they're feeling lonely. Like I said, they're looking for company that isn't in the facility, that you or the other patients necessarily can't provide them at that time. Or maybe they're just dealing with some stress. So we want to keep an eye, because this is an early sign that aggressive behavior may ensue if this patient isn't, if we don't properly treat this patient and prevent this type of behavior, aggressive behavior, from developing. Let's see, early warning signs of aggressive behavior, verbal and physical indicators. So if you see, I started off with social, then cognitive, and now verbal and physical. So verbal and physical is right before we usually see some type of aggressive behavior. So I'm just kind of escalating things. So if it gets to this stage, it's very likely aggressive behavior, it's most likely aggressive behavior may follow. So if you see patient swing the arm at an empty space, if they're yelling for no reason at all, or about something small that's bothering them and they just have a sudden outburst and they're yelling. They don't have to be yelling at you, just yelling loudly, yelling questions into the air like, why do I have to do this? Or things like that. That should clue you in that something may be wrong. These type of actions and behavior suggest that patient will very likely become aggressive. It could be verbal, it could be just physical, or it can be a combination of the two. Um, these patients are, for whatever reason, extremely agitated and having trouble coping by themselves with whatever the stressor is. So we want to make sure that we keep an eye on these patients, and I'm going to tell you what to do if you notice these early warning signs, and how to prevent these early warning signs from becoming actual aggressive events. Um, but before we do, uh, this is an acronym I wanted to share with you, STAMP. And you see I included a picture of a stamp there, STAMP. It's an assessment tool that we can use to recognize an aggressive behavior. Just something quick. I know I went through a lot those past 3 slides. So this is something short and sweet that you can remember, STAMP. That you can remember. If you suspect something's not right about that patient, I want to use my assessment tool, STAMP, that Deontay shared with me, to recognize and see if I'm seeing something that's not really there, or if I'm just seeing something that is there and everyone else hasn't recognized yet that this patient may become aggressive. So STAMP, is the patient staring? Are they are you noticing fluctuations in their tone? Is their volume of voice rising? Do they seem anxious? Are they looking over their shoulders? Do they appear paranoid or easily frightened by things that shouldn't frighten people? Are they mumbling to themselves? Are they yelling out loud? Are they talking to themselves, pacing or rocking back and forth, repetitive motion? STAMP. This is a quick acronym that you can use as an assessment tool to try and recognize early warning signs of aggressive behavior in your patient. Um, so please write that down, remember that, commit that to memory. That will save you or your patient from being hurt by aggressive behavior. So now, this is the good stuff. How can you prevent aggressive behavior? Well, one of the things I mentioned that was a cause of um, a lot of the stress for the elderly patients is they feel like they've lost their freedom. So what can we do to help them not feel stressed by this? We can give them control, give them options, give them choices. Hey, sir or ma'am, do you want to get up and walk, or do you want to play a game? Give them a choice. It doesn't always have to be us telling them what to do. Sit and talk with them, give them the options to make a choice and to feel like they're in control. Also, we want to establish a routine. Get them into a routine so that they can better transition from the life that they were used to living at home to life in an assisted living facility. And you can only do that by establishing a routine and sticking to it. This way they know what to expect, and what they expect coincides with how the assisted living facility is run, how you guys do things on a day-to-day. So you want to make sure specifically bathing, dressing, and eating at the same time each day. And this way the patient can kind of get a feel for how the flow is, and they can decide for themselves how they want the rest of their day to flow around those big events. Bathing, dressing, and eating, those are small things to us. But when we're older, or when we have dementia or Alzheimer's or have suffered from a stroke, these are huge events for us, for these patients. I don't want for much. Sorry about that. Quiet time and activity each day. This again is very important. Sometimes just a little quiet time to help the patient relax, do whatever it is you want to do. Maybe they're feeling fatigue. Maybe something is stressing them out. Offering an activity can take their mind off of it. Some people just like to sit and reflect on their own stress and work through it. Other people need something to redirect their attention from whatever may be bothering them, to help sort through it. So that's another way we can help prevent this aggressive behavior. It's because if I'm stressed out about a doctor who, I saw a doctor the other week and he gave me test results that I wasn't happy with. I know that every Monday we play chess. So I love playing chess, and that will definitely take my mind off of the bad result. And hey, even if I win, I'll completely forget about the bad result. Or maybe I won't forget about it, but it'll make them feel better. It'll take their mind off of it. And it'll lower that feeling of aggression and stress inside of them to a level that they can manage it, or that we can help them more easily manage it and not turn into an aggressive behavior. And healthy foods. If you suspect a patient might be getting aggressive or displaying some early warning signs of aggression, limit the amount of caffeine that they're drinking, the coffee, the tea, sugar, no sugar, none for that day. Um, you don't have to give them a reason why. Just tell them, oh, today we're eating healthy. Oh, you don't need any more sugar. I'm sorry, I don't have any sugar for you right now. Junk food, um, cut out the junk food. Foods really do play a role in our mood, and can become mood altering substances in this population, especially when they're not eating as much as they used to, or you and I would. The food that they eat really can have a role in making them feel more fatigued, or making them feel more energized, or making them feel sad, or making them feel happier that day if they're eating a light meal. It really does impact their mood. So that's another way. Um, Keeping well-loved objects and photos near. This sounds small, but it's huge. And just in my experience as a nurse and observing, when I take care of elderly patients and the family has pictures and cards and memorabilia spread all over the room, I don't remember going into that patient's room and having to deal with them and having to help them work through uh, a, a dementia episode where they become completely forgetting where they are, or having to de-escalate a possibly aggressive patient. I most remember going into rooms and having to uh, help a patient who is suffering from a dementia episode or who's becoming aggressive when there's nothing in the room. And that's when they kind of forget where they are, because it's just a completely new room, blank walls, all this white, clean, tucked away things. They don't know where they are. But when the family leaves photos and balloons and pictures, they look over, they see their family, they just feel more comforted. Um, so make sure that you encourage the family to bring those things, and make sure you keep those near, or make sure you know where they are, or you have an idea of what that patient's favorite object is. So if you're sitting in the activity room and that patient becomes aggressive, you can run and grab their favorite picture and say, look here. And that'll redirect their attention or change their mood. Um, Keep clutter and noise to a minimum. These type of things can become triggers for the patients. Noises, clutter. Um, it's just small things that can make a big difference. Um, and a big thing that I'm a real stickler for, and I'm a real supporter for, is just promoting healthy sleeping habits and a sleep supportive environment. What does that mean? That means knowing, asking them what temperature. Do they like to sleep warm? Do they like to sleep cold? Having an idea of where their temperature is, um, where the temperature is in relative to how they like it. Sheets or no sheets. What are they wearing to go to sleep? Make sure that they dress appropriately for how they like to feel when they sleep. Make sure that things stay quiet. If someone else is if patients next door are a little bit louder, go in and say, can you please tone it down. That'll really prevent aggressive behavior for you, the staff, and the other patients. Making sure the lights are low. Um, Sleep, healthy sleeping, that is huge in preventing aggressive behavior. And once again, I put it here, the biggest thing, give them control, give them choices. That is very important, because you don't want them to feel like they're in a jail, or you don't want them to feel like they're just being bossed around. You want them to feel like this is their home and you're just helping them to live in it. And you can achieve this by giving them choices. Always give them choices. So now, how to de-escalate aggressive behavior. First, I'm gonna ask what does de-escalate mean to you? To me, de-escalate used to just mean taking a situation down from a level 10 to a level 8. How you achieve that, I wasn't sure. What to do to achieve that, I wasn't sure. But as I became a nurse and practiced and learned, I learned that de-escalate really is a complex idea. It's a combination of strategies and different techniques. There are all hundreds of techniques to use to de-escalate a situation. And you really have to learn which one not only works for you, works for your patient, but which one you can effectively use. You may not be that good at talking to a patient, but you may be great at making the patient laugh, or making sure that they're always getting enough sleep, or expressing love towards the patient. So you really need to identify what the different techniques you think you're best at. And that'll really help you in your practice to reduce aggression and agitation. So I have here, this is our last objective, so stay with me. How to de-escalate aggressive behavior. There are 7 key de-escalation techniques I want to share with you. First one is communication. Second, body language. Third, redirection. 4, respond and address. 5, cognitive engagement. 6, environmental control. 7, support and validate. All right, so most of those you should know: communication, body language, redirection, respond and address, and cognitive engagement. Those may be new terms to you. So redirection is just redirecting someone's attention. Respond and address, that's making sure we say the appropriate things and address the concern of the patient. And cognitive engagement, that's exactly what it says, just making sure that they are engaged cognitively. So in the next slides, I'm going to get to how each of these techniques can be used to de-escalate aggressive behavior. So first, very easy, communication. Specific things I want you to remember. Remember to speak clearly. Verbal instruction should be concise and clear. Hey, Mr. Johnson, can you please sit back down? Thank you. That's it. Be very concise, be very clear. Oh no, I should have been even clearer. Can you please sit down back in your chair? Because then he may say, well, where do you want me to sit? You tell him where you want to sit. Be very clear. See, you thought I was clear, but I wasn't. Speak softly, use a relaxed tone. This is a little more difficult because in aggressive situations, you may, if a patient is yelling at you, you may feel compelled to yell back. You may not be able to use a relaxed tone. You may be nervous, you may be scared, but you have to be a mirror. If you are calm, they'll reflect what you are. If you're calm, they'll be calm. If you're nervous, they'll be nervous. If you're speaking softly, they'll speak softly. Just stick to these techniques and they will mirror what you're doing. Listen carefully to what the patient is saying. Actively listening. That means you're not thinking about what to say until you've already heard and understood everything they've said. The goal here is to identify the cause of the aggressive outburst. So you really need to listen. You really need to make sure that you stay relaxed because you want to understand what caused it, because simply understanding what caused it can put an end to everything. Next is body language. You want to make sure you're using non-threatening body language. Well, what is non-threatening body language? I don't think I have any threatening body language unless I want to be threatening. Well, you want to make sure to do that. You never approach a patient from the back, always from the front. If you have to go around them to come to the front, you don't introduce yourself until you're in the front. This can be perceived as threatening by the patient. Keep your arms at your side. I'm moving my hands to talk. That's not what you want to do. Keep your hands at your side. You don't want to put your hand on their back and say it's okay. You don't refrain from physical contact unless they initiate it, or unless you feel like the situation has been slightly de-escalated just by your presence or you using those communication techniques from the last slide. No sudden movements, slow, gentle movements only. And don't forget to smile. This is another difficult one because if someone is yelling at you, It may be difficult to smile, and they may even misinterpret your smile as you laughing, but just reassure them, no, I'm not upset. I'm smiling because I'm happy. I'm not laughing at you. Only use friendly facial expressions. Because if you tell them, I'm smiling because I'm happy, I'm not laughing at you, they'll believe you because you're being truthful. You're not laughing at them, and they'll start to mirror your actions. Eye contact. Maintain eye contact. They want to know you hear them, and you can let them know you hear them and they have your attention by looking at them. But don't force it. Don't stare at them in the eyes and follow them the whole time. Give them some eye contact. Redirection. If the patient is yelling or getting upset, you think they're becoming aggressive, offer them their favorite snack, their favorite drink. Hey, would you like to have a snack with me? Would you like to have a drink with me? What would you like to drink? Ask if they would like to go for a walk, to watch TV. Anything to redirect their attention. Talk about the weather. Talk about your favorite vacation. Ask them to tell you a story. Is there a story you would like to share with me? I'd love to hear a story about your life. The goal here is to redirect their attention to something new. You want to distract them from whatever triggered the aggressive outburst. Maybe they saw something on the TV. Maybe they forgot where they were, or they forgot where they placed their favorite blanket, and now they think someone stole it. You want to redirect their attention from that onto enjoying their favorite snack and telling you a story about their life. Redirection. Respond and address. This deals with acknowledging the problem that the patient has expressed to you, apologizing for it. So I include an example here. Yes, she has already stuck you 3 times to check your blood sugar today. I know that is upsetting and I apologize. Would you mind if I try once more? Where would you like me to try next? So if you see there, I've apologized, I've acknowledged that they've been stuck 3 times, and I've responded. Yes, I understand that how that would be upsetting. I apologize. Would you mind if I try once more? And where would you like me to stick? I'm giving them some type of control in this situation where they feel like they've lost control and may have been the cause of an aggressive outburst. So respond and address. That's very important. I really like this one. It does work. It works a lot for me. I think this might be the one that I'm the best at. Cognitive engagement. When the patient is engaged cognitively and explaining why they are upset, they aren't attacking anyone. Ask questions, engage them. Examples. Can you help me understand what it is you're looking for? What I'm hearing is that you think that someone stole your favorite blanket. What has helped you deal with losing something in the past? Don't say, tell me how you feel, because they're going to tell you that they're upset and they're going to relive that emotion. Ask them instead, can you help me understand what it is you need? Okay, you're looking for your blanket. What have you done to find it in the past? What has helped you in the past to deal with when you lose with something? It may not sound like the best response, but it will engage them cognitively to talk about something else other than this situation here. And through them talking about it, they'll identify, hopefully, what helped them through a stressful situation the last time. And that is what the goal is for cognitive engagement. Environmental control. A few things you want to remember here. You want to keep 2 arms length between you and the patient. If you feel like they're becoming aggressive, you want to make sure that you keep your distance, just in case they do become physically aggressive towards you. But don't block the exits. You don't want them to feel like they're being trapped in, because it's going to be like trapping a stray cat in the corner. They're going to curl up in the ball, and eventually they're going to lash out to try and get out because they're going to think that they're about to be harmed. Decrease the noise, decrease stimulation, and be aware of other office resources and other staff members that you have. Be aware of where they are before you enter into the aggressive situation to try and calm things down. Just in case you need some help, just in case things get physical. You want to make sure where your resources are. Or in case you need someone to hand you Coke for the patient or their favorite snack, and you don't want to take your eyes off the patient. You need to know where your other staff members are at all times when you're dealing with an aggressive situation. Support and validate. This is important because there are different ways to support and validate. Specifically, agree or disagree. Ways to agree / validate. You want to agree with the truth. Yes, she has stuck you 3 times and it hurts. I would be aggravated too if I were you. You don't want to agree with their lies. You just nod your head. But if they say something that's truthful and you agree with it, let them know you agree. Agree with the principle. If the patient feels disrespected, I believe I'm with you. I totally agree. Everyone should be respected. Everyone should maintain their own freedom. That's what you should say to them if they feel like they're being disrespected or they feel like they've lost their freedom. You want to support their feelings and validate them. Agree with the consensus. I'm sure other patients have felt this way as well. Let them know that they're not an outlier. They're not out of the norm in feeling how they're feeling. Support and validate. And last, agree to disagree if you disagree with what they're saying. If they're saying that it's okay for them to yell, be honest if you don't agree. If they feel like you're lying, they'll shut down. If they feel like you're telling the truth, if you're saying, you know, I don't agree with your behavior. I don't agree that you should be yelling. I agree that you shouldn't be stuck 3 times. And I would be upset as well, but I don't think it's okay for you to yell at the staff. They'll respect your honesty and they will open up towards you. And this may even be it. This may de-escalate the situation entirely. So that is the last slide of our 4th objective, which was our last objective. And I have here 2 review questions for you. I want you to answer them and we go to the next slide and we'll see if you got it right. No cheating. So first question, a caregiver allows an angry patient to vent. Which of the following nonverbal behaviors may help de-escalate the situation? So what nonverbal behavior will help de-escalate the situation? Is it A, eye rolling, B, sighing, C, making eye contact, or D, pacing? What do you think? Give you a second here. Okay. Correct answer, C, making eye contact. Remember, we talked about this. Making eye contact with the patient, letting them know that you're listening is a part 1 of active listening. And it's also a way to give them a feeling of respect that you're listening to them, you're hearing them, and it's a sense of acknowledgement for them. So this is the correct answer of a nonverbal behavior we can use to de-escalate the situation. That one might have been a little easy. Let's go to number 2. Review question number 2. Which of the following actions should alert the caregiver most that a patient may become aggressive? A, refuses to take a bath. B, sobs briefly when family visits in. C, converses regularly with staff. Or D, frequently soils their diaper. So which of the following actions should alert the caregiver most that the patient may become aggressive? Which action? They refuse to take a bath. Out of all of these, this one should alert you the most because sobbing briefly when family visits in, that's normal. They're sad. But if they're completely crying and just completely distraught after family leaves and starts having mood swings, that's a red flag. But that's not what it says here. It says brief. Converses regularly with staff. This is good. They're not being alone. They're talkative. This means that they're adjusting to their environment. Frequently soils a diaper. There's nothing wrong with this. They may have had a stroke and they're unable to control their bowel or their urine. Refusing to take a bath, that is an early warning sign that they are feeling a loss of making their own choices for themselves. They're feeling a loss of their freedom. So they're trying to take back that freedom. refusing to take a bath. So I would want to investigate why this patient is refusing to take a bath. Is it because they're feeling angry or frustrated at loss of freedom, or are they just tired? And if they're tired, are they getting enough sleep? Because that could also be a warning sign that this patient may become aggressive. So refusing to take a bath. So in the end, we have lesson summary. I have our objectives here. Hopefully, you can identify some common causes of aggressive behavior. We're going to review lack of sleep, medications, psychological stress, inability to complete ADLs or their diagnosis. We talked about dementia. We talked about Alzheimer's disease. And we talked about stroke. You should also be able to list several early warning signs that a patient may become aggressive. So without looking at this list, you should already know at least 5. Paranoia, if they're hallucinating, if they're becoming disorientated, yelling, pacing, clenching their fists, swinging arm at an empty space. These are all early warning signs that the patient may become aggressive. And you need to redirect your attention from whatever you're doing to this patient to make sure that it is indeed a red flag, and take the proper precautions and preventative measures to prevent this behavior from escalating into a truly aggressive situation. You should be able now to understand and discuss methods to prevent a patient from becoming aggressive. And we know we can do this. My favorite, giving the patients control. And also my second favorite, encouraging activity and rest, maintaining a healthy diet, encouraging sleep, establishing and following a routine. These are all very important things to help prevent the patient from becoming aggressive. And our last objective, which I know that we all checked off together, understanding what to do if a patient becomes aggressive towards you. There are 7 key things. So I put my guy here. He's holding the key because he's got everything. He knows the 7 key things: communication. I'm sorry, not key things, the key techniques: communication, body language, redirection, respond and address, cognitive engagement. So we're asking them questions to take their mind off whatever that stressor was that may be causing this aggressive behavior. Environmental control. We're supporting, we're validating their feelings. Those are our key techniques to de-escalate a situation. Each one of those has a huge impact on the situation. And that's it. I want to thank you for your time today. I hope that you were able to take all the information that I gave you here, and I hope that you will be able to use it successfully on your job. Again, my name is Deontay, and I am here presenting to you on behalf of myalftraining.com. And I want to hope you have a good day. Thank you.